This lecture will be an introduction to sonography and your new chosen profession. Diagnostic sonography is an imaging modality that is used by itself or in conjunction with other imaging modalities such as CT, X-ray, or MRI to provide a medical diagnosis. Ultrasound uses sound waves to image structures that lie beneath the skin, and it provides a cross-sectional view of anatomical structures and is capable of distinguishing the interfaces between the different structures. Many advances have been made in ultrasound equipment since the 1950s when it first became a medical diagnostic tool. At that time, the entire body of a patient would have been submerged in a tank of water for scanning. So below there, you can see an image of an early ultrasound machine, and we have definitely come a long way since that time. Diagnostic sonography works very similar to sonar. Ultrasound is a sound beam with a frequency greater than 20,000 cycles per second, or hertz. Hertz is the measurement of frequency. So for ultrasound, as you can see in the chart here, in order to be considered that, we are at greater than 20,000 hertz. But for diagnostic ultrasound, we are up in the megahertz typically. So it's a very, very high frequency ultrasound. Medical sonograms use a wide range of frequencies to create the ultrasound images. So the range for this is typically anywhere from 1 to 20 megahertz. Applying a short voltage spike to a piezoelectric crystal found in the front of the transducer will produce these frequencies. The ultrasound beam then is a series of waves that transmits energy throughout the body. So you can see in the image, we have an electrical spike which vibrates the transducer and ultimately puts out the acoustic energy or sound waves that will travel through the patient's body. Ultrasound is one of the only imaging modalities that can visualize structures in real time. It can show movement of the body's internal organs, a baby move if they kick or roll. We can show blood flow throughout the vessels or through the heart, and we can even show the heart beating. So here is a video where you can actually see the heart moving. You can see the valves on the heart, and this is called real-time imaging. As a sonographer, you will be a highly skilled medical professional who uses special equipment to emit the ultrasound in order to create these diagnostic images of the human body. You will be trained to acquire and analyze these sonographic images, which will aid in diagnosis of a wide range of medical conditions. You will be an integral and highly specialized member of the healthcare team. Within sonography, there are 4 different specialties: diagnostic medical sonography, vascular sonography, cardiac sonography, and then musculoskeletal sonography. Some of these also have subspecialties as well. You won't typically find a formal training program for musculoskeletal sonography. Most of that is learned on the job. Owens currently offers the other 3 sonography specialties. Diagnostic medical sonographers, or sometimes known as ultrasound technologists, will scan a variety of soft tissue structures. They do not typically image bone or anything filled with air, such as the lungs and the bowel. Typical scans for a diagnostic medical sonographer would include abdominal structures, pelvic structures, obstetrical structures, superficial structures, and pediatric exams. Here are some images of typical scans that a diagnostic medical sonographer would complete. So the first one here is an image of a kidney with the liver, so an abdominal scan. Here is a small part scan of the thyroid. So you can see the soft tissue, the gray structure here, that's the thyroid. And then also an ovary. So this here is the ovary, and you can see ovarian follicles on this image. A diagnostic medical sonographer will be called upon to scan a wide variety of exams. A vascular sonographer or vascular technologist will evaluate the arteries and veins in nearly any part of the body. Using Doppler, they can check the direction of blood flow and even measure the speed of blood flow traveling through the body. They can look for blockages or anything abnormal with the blood vessels. So typical scans for a vascular sonographer would be venous imaging, arterial imaging, carotid imaging, abdominal imaging, and transcranial Doppler. Here are some typical scans that may be performed by a vascular technologist. So the first one here is a carotid ultrasound, and we can see that we have both color and pulse wave Doppler on. So we're able to see blood flow through the vessel, and we're able to measure the velocity. This is an abdominal scan of the mesenteric, and we can also do venous imaging as well to check for blood clots. Cardiac sonographers evaluate the structure and function of the heart to help diagnose a wide range of conditions, including cardiomyopathy and valvular diseases. Using Doppler, they can evaluate blood flow through the heart. Typical types of scans that a cardiac sonographer would perform would be a transthoracic echocardiogram, a transesophageal echocardiogram, and then a stress echocardiogram. Here are some typical images that may be created by a cardiac sonographer. So here is a four-chamber view of the heart. This is from a different angle showing the heart as well. And then we can also do measurements on the heart to check for function or velocities of blood flow traveling through the heart. As a sonographer, you should always be mindful and aware of the sonographer's scope of practice. What sort of duties fall within your job and what type of things should or should you not be doing? So we always want to make sure we're obtaining, reviewing, and integrating pertinent patient history. We want to make sure we're performing appropriate procedures and recording all of the data needed for the physician to interpret. We want to record, analyze, and process diagnostic data. Exercise discretion and judgment in the performance of sonographic diagnostic services, demonstrate appropriate communication skills with our patients and our colleagues, act in a professional and ethical manner, and we want to facilitate communication and education to elicit patient cooperation and understanding of the expectations of the sonographic exam. Here is also the sonographer's code of professional conduct. As sonographers, we should always act in the best interest of the patient. Sonographers shall provide sonographic services with compassion, respect for human dignity, honesty, and integrity. Sonographers shall respect the patient's right to privacy and follow HIPAA, safeguarding any confidential information within the constraints of the law. Sonographers shall maintain competence in their field, so there may be certain continuing education or activities that you need to complete. And sonographers shall assume responsibility for their actions. Sonographers are held at a high professional standard. Here are some advantages of ultrasound imaging. Ultrasound imaging does not use ionizing radiation, so there are no known harmful side effects. With a few exceptions, it is non-invasive, so we do biopsies, which would be considered invasive. We do transvaginal ultrasounds, which could be considered invasive, but for the most part, it's a non-invasive procedure. It is more cost-effective for the patient than a CT or an MRI. Ultrasound is significantly less cost than those type of imaging studies. It is a portable scan and the equipment is less expensive. So we can take our ultrasound machine and we can travel to the bedside, and the equipment is less in general to purchase. Ultrasounds, for the most part, can be performed relatively quickly. Usually, I would say average ultrasound scan is about 20-25 minutes, some being more, some being less. Soft tissue structures can be imaged in detail, and we can record real-time imaging. Here are some disadvantages of ultrasound imaging. Ultrasound cannot be used to examine bone. It absorbs all of the sound waves. It also cannot be used to examine structures surrounded by bone unless a good acoustic window is available. It cannot be used to examine structures containing air, such as the lungs. This is an example of an ultrasound image when trying to visualize a bone. So here we can see the skin surface and then we have some soft tissue. This is the edge of the bone here. You can kind of see the really bright reflector. And then posterior or deep to that bone, the ultrasound beam is completely absorbed and nothing is reflected back to the transducer. So for those reasons, we are not a good modality to visualize bone. Here's an image showing the lung interface. When we try to image anything that contains air on ultrasound, all of the sound is reflected back to the transducer and we're unable to visualize that soft tissue. An acoustic window is a term used to describe an area of the body that easily transmits a sound wave from and back to the transducer. And here are some examples of good acoustic windows. A distended or filled urinary bladder, the anterior fontanelle, and a rib interspace. Here's an example of a good acoustic window, and this is a distended urinary bladder, and that's going to show up black on ultrasound because it's fluid filled. Posterior to that, we are able to see the patient's uterus. Without this distended or filled urinary bladder, this image would not be as clear and we would not be able to see the uterus or ovaries as well as we can with that filled bladder, making for a good acoustic window. Filling the urinary bladder may be part of a patient's prep, depending on the type of exam that you're doing, in order to create this good acoustic window for your ultrasound scan. Color Doppler allows for visualization of blood flow within the heart and blood vessels. And then pulse wave Doppler allows for measurements of velocities that you can take in the blood vessels and the heart. So here on this image, you can see the color is turned on. This is what this box is here. This is the aorta, and within that box, we see this red. So this would be our color Doppler that's showing blood flow going through that aorta. Also, this line here with this angle, that's going to be your pulse wave Doppler. That information presents here in your Doppler waveform on this baseline. So with this, we're able to measure velocity, which is the scale over here to the side, so we can actually tell how quickly the blood flow is moving through that vessel. The transducer is what you'll be scanning with and actually placing upon the patient's body to create the ultrasound image. And these transducers come in a wide range of frequencies and in several different configuration types. The transducer must be selected with care to adequately evaluate the area of interest. So depending on what you're going to be scanning depends on the type of transducer that you'll choose. So here are some examples of transducers and the different types that you may use. Depending on what you're scanning will dictate your transducer selection. So we have linear types of probes that will be used for small parts and vascular scanning. We have endocavitary probes that can be inserted into the vagina or the rectum. We have curvilinear probes that would be used for anything deep as far as abdominal or pelvic structures. And then we have sector type of probes that are typically used for cardiac imaging. Ultrasound can be used to direct needle and catheter placement for biopsies, fluid removals, and stenting. And these are termed as types of interventional sonography. And a lot of times these are done right in the ultrasound suite with an interventional radiologist. So here's an example of a needle that can be seen on ultrasound, and this is being inserted into a breast mass. So that way, when the physician is doing the biopsy, they are able to directly see and tell that the sample being taken for the biopsy is right in the mass or where they want it to be. The advantage of using ultrasound for interventional procedures is that we can image in real time as well. Here are just some images showing what that setup might look like with the use of the ultrasound probe and a sterile field, and then how we direct the needle to be in line with the ultrasound probe so that way we're able to see that on our image. The sound beam. Ultrasound can be used to characterize the nature of tissue because of the interaction of the sound beam with the tissue. So different structures on ultrasound will show up differently as far as their shades of gray. So something that is fluid filled, these do not impede the transmission of sound. So they typically do not have any echoes and will appear black on ultrasound. And we term this as being anechoic. There will be increased echoes posterior then to a fluid-filled structure, which we term posterior enhancement. The sound is enhanced posterior to that structure. This is because of the dramatic change in the interface between the structure and the surrounding tissues. So this is an image to help show the different interfaces and the interaction of the sound beam with different tissues on ultrasound. So this is an image of a fetus, and we know that anything fluid filled is going to show up black on ultrasound. So this would be the amniotic fluid. We also see the profile of the baby here, and bone is starting to form, which shows as a very bright reflector. Posterior to that, we have fetal brain, and we even have some shadowing that's happening here from likely some bone forming again within that fetus. So all of these things will show up differently on ultrasound depending on their tissue makeup. And with the trained eye, you'll begin to recognize these different structures. Here's another example to show the different interaction of the sound beam with tissue. So here is another anechoic structure. This is the aorta, and it is showing up black on ultrasound because it's filled with fluid. This here is a portion of the liver, and that is showing as a gray structure. But next to it, we have a portion of the pancreas. And it is subtle, but you can see that the pancreas appears slightly brighter in comparison to the liver tissue. So that's how we can differentiate between different structures. We also have the spine here posterior, and then it's completely black posterior to that. This is because the spine is absorbing all of the sound and it is not reflecting back to the transducer. We are able to take measurements with our ultrasound scan as well. Quantitative measurements can be made of visualized anatomic structures and pathology. All ultrasound equipment has electronic calipers that allow several measurements to be made on a single image. Many different types of measurements may be obtained, such as circumference of a structure, the length, the height, the width, different velocities, and even percentages. Here is an example of measurements showing measurement for a velocity. So our velocity scale is over here on the right, and we're able to put a caliper at the very peak of this waveform. And up here we have our peak systolic velocity is showing at 98.7 centimeters per second. So this lets us know how quickly that blood flow is traveling through that vessel. Here are some calipers on a gallbladder wall. So this gives us a two-dimensional measurement. They're a little hard to see, but you can see them right here. That's measuring the gallbladder wall, and it's showing down here at 0.142 centimeters. Here are some measurements showing the heart, and we are able to take some measurements that actually show us the ejection fraction of the heart and how well it's functioning. By finding out what type of learning style you prefer, you may be able to hone your study skills and improve your ability to retain information. There are quizzes on the internet that you can take that helps you determine your learning style. Some of us learn best by doing, and we are more of tactile learners. I think a lot of us in ultrasound probably learn best that way. Some of us learn best by listening, and we're auditory learners. And some of us learn best by watching, and have more of a visual learning style. It can be easy to become overloaded with the amount of work in a sonography program. Make sure you're approaching just one exam at a time, one assignment at a time. Looking too far ahead, of course, can cause anxiety and it may feel overwhelming. Put full effort into focused, dedicated study time for each exam as it comes up. And then, of course, you should reward your efforts when you do well on a test or an examination. Get yourself a coffee, go out for an evening. Also, make sure you're using your school breaks to relax your mind and do some enjoyable activities. It's okay to take a break. Make sure you're utilizing the scan lab as much as possible. Practice will help gain confidence and skills. The more time that you spend in the ultrasound lab, the more successful you will be because the more practice you've had to really work on those skills. Once you get to clinic, your success in the clinical setting depends on the following: building your scanning skills and scanning as much as possible, working on your patient care skills, your professionalism, and your work ethic. Observe how sonographers interact with patients, the interpreting physician, and others on the healthcare team. You really want to try to start mimicking those behaviors. You will also want to work with numerous different sonographers to make the most of your education. You can learn something from everyone. Some other success tips: be adaptable and be open to constructive criticism. We are here to help, but we are going to give you things that you can improve on and that you can work on. Utilize your instructors. They bring a wealth of knowledge to the program and years of experience. Lean on them, pick their brains, ask them questions. They're here to help. Try not to get discouraged. Always strive to do your best. Make any notes of where you've struggled and how you can improve. And again, ask your instructors for guidance or help. That's what we're here for. Here are some time management tips for sonography students. Use TV and movies, Netflix as a reward, not as a time waster. Put your device down, walk away, take a break from your tablet and your smartphone. I know I can get wrapped up in scrolling Facebook or TikTok for hours on end, so if you can set those boundaries. Plan your day and your week, make out a calendar, and set your own deadlines for assignments early. We are going to give you certain deadlines, but if you can have it done before the due date, that's going to reduce your anxiety. Critical thinking is a crucial skill that you will need as a sonographer. Here are some qualities of critical thinkers. A critical thinker asks vital questions and recognizes problems. They gather and assess relevant information, comes to well-reasoned conclusions and solutions. They test those conclusions and solutions against relevant criteria. Critical thinkers think with an open mind, and they communicate effectively with others in order to figure out solutions to complex problems. You will likely find in this program, we don't typically just give you the answer. We expect you to critically think and possibly even come up with the answer on your own. Here's an example on how a sonographer would apply critical thinking skills. So when taking a patient history, they may dive deep into those patient history questions to discover essential facts and then establish inferences or conclusions based on those facts. We are already making assumptions of what we may see or find on the ultrasound scan, and then we're able to apply those inferences to the scan. Emotional intelligence is defined as the ability to perceive, use, understand, manage, and handle emotions. People with high emotional intelligence can recognize their own emotions and those of others. And these are kind of the 5 pillars of emotional intelligence. First, self-awareness, having a thorough understanding of one's emotions, strengths, weaknesses, need, and ambition. Self-regulation, an ongoing conversation we must have with ourselves that frees us from feelings. Motivation, to achieve beyond everyone's expectations, including one's own, and to achieve just for the sake of achieving. Empathy, being aware of and considerate of other people's feelings. And social skills, combining friendliness, cooperation, and effective communication to improve interactions. Having a high level of emotional intelligence will be a crucial skill as a sonographer. Because ultrasound is such a hands-on skill, anything that you can do to improve your hand-eye coordination will help you as a sonographer. Here are some ideas. Play video games. It also helps with spatial recognition. Start playing an instrument or pick up a new sport, play catch, or a new hand-eye hobby such as sewing, quilting, or painting. A lot of these things can also help you relieve stress. So this was just a brief overview of what ultrasound is and what it has not only to offer our patients, but for those of us who have chosen ultrasound as a career. Over the next 24 months, you'll be introduced to many different aspects of ultrasound and what it's used for, and each program will get more specific on the types of scans that you'll be performing. We hope that you'll find this to be a rewarding career and that you love ultrasound just as much as we do.